Hi class, in this recording we're going to focus on fever and inflammation in great detail. So when we think of a fever is just loosely defined as an abnormal elevation of a body temperature, not a specific temperature measurement. So if your baseline body temperature is 96 degrees Fahrenheit, you could have a mild fever with a temperature of 98 degrees Fahrenheit. If your baseline body temperature is 99 degrees Fahrenheit, you could be totally fine and not have a mild fever with that 99 degrees Fahrenheit. So it is a little subjective on a patient-to-patient basis. Usually a good threshold is 100 degrees Fahrenheit in terms of whether or not we're at the threshold of being feverish. Now, when we think of a fever, the technical term for that is pyrexia. And if we see this term febrile, febrile refers to anything that is related to or pertaining to a fever. For instance, a lot of times you hear about febrile seizures. A febrile seizure is when a patient starts to seize because of their elevated body temperature. And fevers are caused by many different things. We have trauma, infections, drug reactions, brain tumors, particularly of the hypothalamus, or other causes as well. And as we look at our fever, it's a pretty decent adaptive defense mechanism. And then here's the key phrase here, in moderation. Fever does more good to our bodies than harm us. Runaway fever, that's a problem. If we have mild fever, it's going to promote the activity of interferon. It's going to elevate the metabolic rate of the white blood cells, the leukocytes, and accelerate tissue repair. And then finally, a mild fever inhibits the reproduction of both bacteria and viruses. So not only does it make our immune system function better, our immune cells function better, it makes the pathogens not function as well. Now, when we have a fever, a lot of times we're super uncomfortable, and a lot of times the body temperature gets so high that it becomes a problem. To lower a fever, we need to give a patient an antipyretic, a medication that lowers the fever or the body temperature. Common antipyretics are going to include aspirin, ibuprofen, and or our Tylenol. I'm drawing a complete blank. Not acetylcholine. Oh, come to me in a moment. Anyways, Tylenol, which is not in this category of antipyretics. And these medications are all going to inhibit a prostaglandin synthesis. Aspirin and ibuprofen in particular target prostaglandin E2 synthesis, and if we can't synthesize or downrate the rate of synthesis of that acetaminophen, that's Tylenol. Tylenol is technically known as acetaminophen. Sorry, I'm back on topic here. So if we downregulate prostaglandin E2 synthesis, then we are not going to be able to produce as many pyrinogens and have as elevated of a body temperature. To trigger a fever, we need some kind of pyrogen, chemical that raises our body temperature, that's exogenous. So it's going to be an extracellular pyrinogen. And as we look at bacteria, the glycolipids, particularly glycolipid A, is a potent pyrinogen. Also, as we look at viral surfaces, the proteins and glycolipids on the surfaces of viruses are capable of inducing fevers. Endogenous pyrogens are pyrogens that don't come from an external source, but instead come from an internal source, like our neutrophils or macrophages. And these are going to affect the hypothalamus, where our body's thermostat resides. And these endogenous pyrogens raise the hypothalamic set point for body temperature. So these endogenous pyrogens travel through the bloodstream, go to the hypothalamus of our brain, and tell the hypothalamus of our brain, hey, let's turn up the heat. And then within the hypothalamus, we have prostaglandin E2 synthesis, which is going to raise the set point of our body temperature even more. As we look at fever, we can break the fever up into 3 stages: onset, stadium, and deferescence. We'll talk about those 3 stages in just a second here. So here we have stage 1, onset. Onset is when the body temperature is going to increase. Now, before the body temperature can increase, we need to introduce the pyrogen, and the pyrogen needs to travel to the hypothalamus, and turn up the body temperature, the thermostat, so to speak. And then after onset, body temperature has been elevated, and it typically fluctuates just a little bit. And this is called the stadium phase of fever, where the body temperature is going to remain elevated and will oscillate around the new set point. And then finally, we have the source of the pyrogens eliminated. The infection has been ended, and we go to the deferescence phase. And during this deferescence phase, the pyrogens are removed from the bloodstream. We have immune clearance of the pyrogens, and the body's thermostat is set back to its previous body temperature. By definition, 37.5 degrees Celsius. Let's talk inflammation. Inflammation is it's the much maligned response of our innate immune system. It's a local defensive response to tissue injury, and it can be a very good thing. Inflammation limits the spread of pathogens so that it's easier for us to destroy them. It also is going to make it easier for us to remove damaged debris and initiate tissue repair. So inflammation can be a good thing, but like anything in life, we need a little moderation. Too much inflammation is bad. Too little inflammation is not good. We need just the right amount. Not too much, not too little. We're looking for that nice, sweet Goldilocks zone. Now, as we have inflammation set in, we have 4 cardinal signs: redness, swelling, heat, and pain. Let's talk about each of those signs in a little bit more detail. Let me check here. I could have swore I had. Here we go. We're going to skip a slide. I'll come back to that last one. So as we look at those 4 cardinal signs of inflammation, heat typically is from hyperemia. If we have elevated blood flow to the site that's inflamed, that's going to result in us having more heat from the blood being delivered there. Redness is also due to the hyperemia. As we have more blood, we have more red blood cells, and more red blood cells means more redness. We also have swelling or edema. As we have extra fluid sent to that part of our body, we're going to have more fluid filtered into the extracellular fluid, and that more fluid leaving the blood capillaries and going to the extracellular cavity is going to initiate edema or swelling. And then finally, pain. Pain is going to be caused from direct injury to the nerves, so the initial injury, but as there's some swelling, and usually this is when inflammation becomes bad. If we have too much swelling, the nerve endings are pushed against by the edema or the swelling of the tissues, and that's going to stimulate more pain receptors. We're also going to have stimulation of pain receptors by some prostaglandins, bacterial toxins, and bradykinins. The prostaglandin and bradykinins are good. If we have inflammation, generally speaking, there's an injury, and we want that site of injury to be a little bit tender so that we stop using it and give it a chance to heal. The problem is when we have excessive pain or excessive swelling or excessive heat and redness. It's when we have too much of a good thing that we have the problem. So let's go back to this slide right here. When we look at the term itis, itis is a suffix that refers to inflammation of. Inflammation of the arthritic joints is called arthritis. Inflammation of the pancreas is pancreatitis. Inflammation of our skin is dermatitis. And as we look at all these itises, there are all these different inflammations. They can all be regulated by cytokines. And as we look at cytokines, these are just small proteins that help to regulate this inflammatory response. Most cytokines are going to come from white blood cells, so leukocytes, and they will alter the cell that receives them. And they can act as kind of a short-range signaling molecule, a paracrine molecule, or they can act on the cell that secretes them themselves. So the cell could secrete a cytokine, and the cytokine can turn around and go directly back to the cell that secreted it and have an effect on that cell. And in that situation, it acts as an autocrine molecule. These cytokines that regulate inflammation include many subproteins, such as interferons, interleukins, TNF, tumor necrosis factor, otatic factors, and some other ones that we don't have time to go into right now. So let's talk about neutrophils at the site of inflammation. At the site of injury, so let's say you have a splinter of wood stab you in the skin. It punctures through the skin and introduces lots of bacteria. Those bacteria and damage from the tissue cause signals to be released. And we're going to have some inflammatory chemicals at the site of tissue injury. Those inflammatory chemicals are going to recruit mast cells from the connective tissues. They are going to recruit neutrophils from the bloodstream. And then those neutrophils in particular start to attack the bacteria that are introduced. They start to phagocytize the bacteria and activate our innate immune system to focus on addressing the cause of the pathogens getting into our bodies. So this term right here, margination, is a unique term. It's a term that refers to how leukocytes can stick to the outside of a blood vessel, the endothelium of a blood vessel. And this means the leukocytes don't race through the bloodstream super fast. Instead, they roll and bumble along the large margins of our white blood cells. And then if those leukocytes are exposed to a chemical that can draw them out of the bloodstream via chemotaxis, those leukocytes will go through a process known as diapedesis. So here we have a site of, let me clear the screen for us, it's getting kind of messy. So we have a site of injury. And at this site of injury, we're going to release some little tiny red inflammatory chemicals. These could be a leukotriene, they could be a bradykinin. These are just inflammatory chemicals that are shouting out and saying, hey, neutrophils, get the heck over here. I need a neutrophil. I have some bacteria invading and some tissue damage. And in response to that, the neutrophils will go through diapedesis, dia meaning two, ped meaning foot, and this diapedesis process is when we have the neutrophil squeezing itself through the endothelial cells, and we have, it looks like 1-2 big feet to the cell. And then the neutrophil is going to be attracted to areas of higher chemical concentrations, higher bradykinin or leukotriene concentration as we go through chemotaxis, and they are attracted to the site that has lots of bacteria from that injury. That's all we have on this recording. If you have any questions or comments, please feel free to post them in the class discussion board or to shoot me an email. And as always, happy studies.